left femur. An MRI showed a lobulated margin of low signal intensity corresponding to the sclerotic margin.
What is the most likely diagnosis? Chondroblastoma. 45. A 20-year-old man slowly developed predominantly nocturnal low back pain. He reports that salicylate-based medication is particularly helpful in relieving his pain. What is the most likely diagnosis? A fibrosarcoma. B. Malignant fibrous histiocytoma. C. Osteoid osteoma. D. chondrosarcoma. E. 0-11 years disease. 46. A 76-year-old man presented with pain in his left femur. There was a long history of Paget's disease and bony tenderness about his knee on the medial femoral condyle. He denied any history of trauma, and a radiograph showed an area with sunburst periosteel reaction within the pagetoid bone. What is the most likely diagnosis? Osteosarcoma. 47. A 12-year-old was shown to have an eccentric, lobulated lesion involving the cortex and medulla of the proximal tibial metaphysis with a sclerotic endostele border but no periosteel reaction. A subsequent CT showed no soft tissue extension or fluid levels. What is the most likely diagnosis? Chondromyxoid fibroma. 48. An 11-year-old boy with hip pain was found to have an osteoid osteoma of his right neck of fenner. What is the most appropriate treatment of this lesion? Percutaneous radiofrequency ablation, RFA. 49. A patient presented with a long history of pain in her wrist and 9, history of trauma. A radiograph showed a sharply marginate lesion with multiple foci of popcorn-like calcification. Bone densitometry was within normal limits. An MRI showed hypointensity to muscle on both T1 and T2 weighted images and no fluid collections. What is the most likely diagnosis? Fibrous dysplasia. 58. 27-year-old Afro-Caribbean patient with known sickle cell disease presented with ongoing pain, left arm pain following a crisis, and was found to have osteomyelitis of his humerus. What is the most likely causative organism? Staphylococcus aureus. 51. A mildly expansile lyric lesion was noted in the femur of an otherwise well 14-year-old boy. This was well defined and unilocular and extended from metaphysis into diaphysis. The remaining bone was well minor released and there were no associated aggressive features. What is the most likely diagnosis? Simple bone cyst. 52. A 6-year-old child presented unwell with a history of 12 weeks of pain and swelling over the left knee. On examination, they were pyrexial and noted to have a knee effusion. Blood tests showed a raised erythrocyte sedimentation rate, ESR, and a radiograph showed an aggressive destructive lesion with a permeative pattern of bone destruction in the distal and mu and alliolated, onion skin, periosteel reaction. What is the most likely diagnosis? Ewing sarcoma. 53. A 15-year-old boy was recently diagnosed with a Ewing sarcoma of his vertebral column. Which segment is most likely to be affected? Sacrum. 54. A 6-year-old boy was brought to the GP with his parents after sudden onset of pain in the proximal humerus. Radiographs reveal fracture through tie, a simple bone cyst. What imaging features would be most typical? Thin cortex with mild expansion. 55. A 32-year-old man presents with pain and swelling in his right shoulder of 4 years duration that has gradually been getting worse recently. He works as a mechanic and has been having increasing difficulty using his right arm for the last few months but is otherwise well. On examination, he has an obviously swollen right shoulder. A firm mass is palpable over the lateral aspect of his proximal humerus, extending distally to his elbow. There are also equal stupal palpable axillary lymph nodes. A radiograph of his shoulder shows a mottled, permeative lucency in the head of the pons. What is the most likely diagnosis? Non-Hodgkin's lymphoma. 56. A 9-year-old girl presented with pain and swelling of her left lower leg over the anteromedial aspect of her tibia. A radiograph showed an aggressive lesion with mixed lytic/sclerotic appearances in the proximal tibial metaphysic. A biopsy was taken which showed odd-looking pleomorphic cells and stained positive for osteoid. What is the most likely diagnosis? Osteosarcoma. 57. A 5-year-old boy was noted to have multiple hard swellings predominantly around his knees, and radiographs showed multiple bony outgrowths extending laterally from the bone and pointing away from the nearest joint. The overlying cortex remained in continuity with the native bone, although there were some modeling deformities associated with the lesions. What are the individual lesions? Osteochondroma. 58. A 16-year-old female was investigated for a lucent lesion in her spine and a primary bone tumor was suspected. As part of the workup, a 3-phase bone scan was performed and the lesion of interest showed high activity in the blood pool phase. What is the most likely diagnosis? Aneurysmal bone cyst. 59. A 25-year-old patient presented with back pain and was found to have a single abnormally dense vertebra, which remained of normal size and shape. The end plates were of normal appearance. What diagnosis is the most likely? Sclerotic osteosarcoma. 68. 39-year-old male presented with a long history of back pain and was eventually diagnosed with an ependymoma. Where was this lesion most likely to have occurred? Cervical spine. 61. Which statement best describes the characteristics of a chondromyxoid fibroma? Geographic bone destruction with a prominent sclerotic rim. 62. At what age does a chondroblastoma usually present? 10 to 20 years. 63. How are enchondromas most likely to present? Pathologic fracture. 64. A 42-year-old patient was investigated for acute abdominal pain and had a CT. There were features of inflammatory bowel disease and an incidental finding of a hemangioma in the L1 vertebra. Which part of the vertebra is most likely to be involved? Vertebral body. 65. What is the sex distribution of patients who develop Ewing sarcoma? 1 male, 2 female. 66. A 40-year-old female presented feeling unwell and was found to have a raised serum calcium and alkaline phosphatase with a borderline low phosphate. She had several recent episodes of renal colic and felt generally weak. An X-ray of her pelvis showed a lytic lesion that was associated with an underlying endocrine abnormality. What is the likely imaging appearance? Well-defined cortical lesion with no periosteel reaction. 67. A young adult female with severe acne had several episodes of inflammatory joint symptoms and a radiograph of her knee showed juxtaarticular osteoporosis. She also had evidence of osteosclerosis of several vertebrae with paravertebral ossification. What other skin rashes she at high risk of? Palmoplantar pustulosis. 68. A 5-year-old boy injured his leg in the playground and a radiograph was obtained the same day. This demonstrated a pseudoarthrosis of the fibula. What is the most likely underlying diagnosis? Neurofibromatosis. 69. A patient presented with pneumonia and had a chest radiograph. This showed absence of the clavicles. 13 pairs of ribs and a narrowed thorax. What is the likely inheritance of the underlying condition? Autosomal dominant. 78. 30-year-old man had a shoulder radiograph following an injury that showed no fracture, but there were multiple small, up to 6 millimeters, ovoid bone islands throughout the bones with the long axis running parallel to the bone. He remembered that his father had a similar condition and asks whether it puts him at an increased risk of malignancy. What is the increased risk? No increased risk. 1 headaches, visual field defect.
इसके ये बिल्कुल नाइडस की तरह एचओ की तरह 3 में होता है, ठीक है। 3 में या 3 में बड़ा हो जाए तो बस याद ब्लास्टोमा जो ब्लास्टोमा जो याद रखो ब्लास्ट 238 ये जी एमसीक्यू था T8 बॉडी में भी था मास्कुलर नाइडस विद मैट्रिक्स ऑस्टियोइड मास्कुलर भी होते हैं, ठीक है। जो ब्लास्टोमा में नाइडस विद मैट्रिक्स विद ऑस्टियोइड, ठीक है। और जो है जब 3 में बड़ा हो और ऑस्टियोइड जो लगता हो तो वो है कॉन्ड्रोब्लास्टोमा, ठीक है। और जो ब्लास्टोमा के ब्लास्ट 238 एंड मास्कुलर, ठीक है। और नाइडस विद मैट्रिक्स नेक्स्ट एग्जाम है ये एग्जाम है which tumors looking at retired chondroblastoma, ठीक है। तो याद रखो कि पेशेंट हैज lethargy alpha lymphoma, ठीक है। एक चीज़ ये होती है कि misclodic and lucent flame shaped legend होते हैं, ठीक है। ये भी अच्छे आगे sarcoma, इसके बारे में होता है and prior to reaction हो सकता है, इसमें and prior to reaction sunburst की तरह। तो इसमें ये है कि जो है लेजर में ट्रांसलूसेंट बाइसिस में होते हैं और नॉब्लेयर भी होते हैं, कैल्शियम भी होती है और डॉक्टर रिलीज बाई सैलिसाइलेट मेडिटेशन अर्चुअल स्टोमा, ठीक है। सनबर्ड पैचुअल रिएक्शन अर्चुअल सरकोमा, ठीक है। मेटाफाइल में जो लेजन हो तो करना मैगजाइड सरकोमा, CMFM फॉर मैगजाइड, M फॉर मेटाफाइल। ऑस्ट्रेलिया अर्चुअल ट्रीटमेंट है रेडी ऑल है। ये टिपिकल फाइब्रोसिस पहले की तरफ जा रहा है, ठीक है। कॉपर कैल्शियम बोन में जो है फाइब्रोसिस पहले में आता है। इसमें डायग्नोसिस है नॉन हॉटकिन लिम्फोमा। हॉटकिन लिम्फोमा जो होता है बोन में रेयर होता है, तो शोल्डर में हॉटकिन लिम्फोमा नॉन हॉटकिन। ट्यूमर सेल स्टेन पॉजिटिव फॉर ऑस्ट्रेट तो ऑस्ट्रेट सरकोमा, ठीक है। abdominal vertebra normal size shape और स्पाइरल पर नॉर्मल है तो ये स्क्लेरोटिक ऑस्टियोआर्थराइटिस का होने वाला है, ठीक है। ये रट्टा का, ठीक है। ये वो जब एक बोन स्ट्रक्चर परमानेंट स्क्लेरोटिक CMF में होता है, ठीक है। ये भी रट्टा का about 10-20 years है। ये सैपो सिंड्रोम है, ठीक है। इसमें एस हर सैपो में SAPHO तो P फॉर palmoplantar pustulosis है। बाकी सब कुछ SAPHO में इतनी स्किन रैश भी है, लेकिन P नहीं है ना, P palmoplantar pustulosis। Pseudo auto fibrosing NF1, ठीक है, न्यूट्रोमाटोसिस। क्रीडोक्राइनल डिस्प्लाजिया की ये फीचर्स है तो 13 पेयर और रब्स है, वो डोमिनेंट है, ठीक है, और डोमिनेंट।